this career is a calling. But if you say that you are struggling, you don't get to actually say that because you're going to lose your gun and badge.
Welcome to FEM MD, real talk for women who are balancing careers, ambition, and the chaos that comes with it all. Today's guest is Dylan Cade Bates. She works in law enforcement, is an advocate for mental health, and is the founder of Blonde and Blue, a peer support group for first responders and their families. I do think there are some parallels that I draw to Dylan. You know, she works in law enforcement as a female. I'm a female surgeon. I think we're often looked at differently when you compare us to our peers, both from like a patient or community perspective and a peer group perspective. So I'm interested to chat with her about that. I also want to talk about mental health and what goes into that as a first responder. Certainly working in a hospital and then her serving her community. She's seen lots of things, been in kind of bad experiences. I think in both of our worlds, law enforcement and surgery, we probably tend to push things down, cover them up, just kind of quote, get over it, when really there's probably a missed opportunity to heal from some of these things early on rather than just keeping them inside. Dylan, it's so good to meet you. So I'm a physician, and working in a hospital environment certainly comes with lots of like stress. I think mental health is something that's like coming to the forefront of discussions more and more every day, which I think is great. And I want to talk to you about mental health advocacy and your job as a first responder in law enforcement.
You know, the only other thing I wanted to be was a mermaid, and my fins never came in. So I decided law enforcement was my route. I just, there's a saying in the first responder field that this is a calling. It is not something that you just, you know, decide to do. It's truly a calling. And I think I think I speak on behalf of a lot of first responders when I say that, once you get into it, you really can't even imagine doing anything else. You feel called to serve, and it's not because, a lot of people will say, oh, well, they signed up for, the hate and the backlash and all the things that come with being a cop. But that's not the why we got into it. We got into it because we have seen so many horrible things. A lot of law enforcement are actually the product of traumatic experiences as children. So you grow up in an environment that can come from a traumatic experience. And not to say that everyone has that, but the point is that we get called to serve. We want to see people, we want to be there for them in their worst moments and help them bring it to a better moment. And we want to change people's lives. And I think there's a little bit of disillusionment in that as you get into the profession, but we'll get into that later.
Yeah, I feel that wholeheartedly. I think that a lot of times we like pick our career before our frontal lobe is developed and it looks shiny and exciting. And yes, I'm going to help people. Again, I think there's a lot of parallels with like healthcare and law enforcement. And then you really don't have an appreciation of what you're signing up for and all of the challenges that come with interacting with the community in a time that
Absolutely.
potentially is the worst day of
Absolutely.
their life.
Couldn't agree more. I think, the medical field actually is something I consider first responders as well. You're working in the ER. Actually, a lot of my very close friends are nurses and doctors that I've worked with. They're just seeing me with frequent flyers, and if I have a missing child, and being able to call and say, hey, we have a missing child or we have a missing person. I know you can't give me any information, but hey, I want you to know, like, this is what it is. If I have to get a warrant, I will, but I want to call and let you know that this is the person we're looking for. If they're there, have them call us, hypothetically, have them, let us know. Otherwise, we can come by the hospital and take a look in each room and go from there. And it really builds that team collaboration. And we're all, law enforcement is only successful because of the people we work with, the partners, the fire department, the EMS, the medical workers in the hospital. And it's really a team effort all the way through.
So you're a detective with the police department in a remote area of Alaska. Tell us more about both working in a remote area with limited potentially resources compared to other cities and also your experience being a female in a like heavily male dominated field.
Oh man, working in Alaska has been unlike any other place on earth. Where I worked in Alaska is a extremely remote area. We have our cell service goes down, the internet goes down, our radios don't work half the time. We often have one dispatcher rather than a huge call center. But the crime rate per capita is similar to that of Chicago. Keep in mind, Alaska is
Oh.
2.5 times the size of Texas. And the area that I work in is so remote, you can only get there by plane or by boat in the summer. In the winter, you can go to the villages surrounding, but you can't like go from Anchorage to Bethel on a snow machine because it's over 400 miles. But you can go to the 56 surrounding villages. So we're in Southwest Alaska, right off the Bering Sea, 40 miles upriver off the Bering Sea. And I mean, it's almost like working in a third world country compared to where I had been working in DC most of my career. It was an extreme culture shock. And it really stripped me bare. It taught me so many life lessons and it was extremely humbling. So I mean, I can't say enough that I love it. I love the people I work with. I really got to know the community there and built rapport with the community, which is something that I didn't really get to do while I was working in the DC area, just because it's so much bigger in terms of so many more calls. When you go from DC to Alaska, for me, the call volume was very slow, because I was going from gunshot wound to,
Mhm.
um, sounds of gunshots to, DUI, critical incidents, and that was pretty much back to back. But in Alaska, I got promoted to detective very quickly. And so once I started that, I started working directly with victims, not just running call to call. And um, the crime rate there, like I said, is high, but working with the victims and being able to hear their stories and really let them know that someone does care. Um, and it's unfortunate because a lot of cases don't go through the justice system. But at the end of the day, all I can do is the best I can do at my job and be there for them and let them know that no matter what happens, that you are believed, you are heard, and do the best I can. And as far as being a female in law enforcement, it has had a lot of challenges. And I think the biggest challenge in Alaska was the culture. There's a huge cultural difference. Women are not as respected as men. So there was that aspect, and really trying to work through that and understand that. And when I first got out there, I really needed to, before anything else, understand the culture, and because they need respect, right? And I am someone who believes that respect is not earned; it's given. And when you give respect, even when you're being disrespected, eventually you're going to get it back. Whether that's right then, probably not. But you respect someone who's treating you like absolute, BS, and you keep giving them that respect. Later on, those people were the ones who, intervened when I mean, they saved my life. You get stuck with a subject in the middle of nowhere because you're snowed in. Well, now you're snowed in at their house with them, and the only way back is to ride through a snowstorm with them on the back of your snow machine. So you really have to have that respect. And I personally haven't felt a lot of disrespect as a female in law enforcement until I went to Alaska. Just because the DC area, there are a lot of women in law enforcement. And I think the only difference is really the response from the community. Um, my colleagues that I've worked with, I've been very fortunate to say that, they didn't treat me any different because I was female. So that is something, that a shift in culture that I've
Mhm.
seen, which I love. But in Alaska, it's just very different, and the culture, even in DC, being a female, wasn't necessarily the issue. It was my appearance. because I'm a 5'10" blonde, I'm curvy, and when I walked into a room or a call, it was cat calls and things like that rather than the respect, that I'm trying to give and receive, right? So, um, when someone just looks at your appearance, they judge a book by its cover, but, I'll digress there.
For sure. Yeah. And for those who are listening right now and not watching the interview online, Dylan is a bombshell. She's gorgeous. You look like a supermodel. um, okay, that's interesting because I have a few follow-up questions. The first is in reading about you, learning more about you before today, I did wonder, like, what's the difference between your relationship with colleagues, like in your own department, which it sounds like you do have respect there and a good sense of support from your team versus the relationship with the community. And you talked about how it was kind of a culture shock. You also talked about how when you moved to Alaska, it felt like a completely different country. When you first moved there, did your department or colleagues prepare you for that culture shock? Like, did you anticipate that? Did you get any like formal training? Or was it something that you just showed up and you're like, oh, wow, this is like a self-realization moment where this is going to be completely different than what I'm used to?
So, I knew it was going to be completely different from what I was used to. I did not know how different. So no, I was not completely prepared for that. But I will say, I did ask a lot of questions before I started, and I also the way I found working as an officer in Alaska was actually because one day my mother came over. She was visiting me from California, and somehow she couldn't work Netflix or anything like that, but she got like an old episode. There's like 3 channels on like regular TVs, even if you have like satellite or something. There's like 3 regular channels before it goes to like static, like The Ring or something, right? And she found a rerun
Hmm.
episode of Alaska PD from like 2002. And I was sitting with her and doing other things, and she goes, "Dylan, oh my gosh," and I got startled because cop, and I turn and look, and she's like, "There's a cop being chased by a bear," and I was like, "What?" And saw that and I was like, wow, that's really cool. And then later on, it showed the officers in Alaska traveling 2 weeks on, 2 weeks off together. So my lieutenant in Alaska was actually flying in and out from Australia. I was flying in and out from DC. My whole department is, with the exception of 2 or 3 people, are not from Alaska, but most of us are made up of, we call them lateral officers. So we're experienced officers. So we have a wealth of knowledge. Um, the difference in that when you work in an environment like that is that that knowledge is not always in sync with one another because the laws in Georgia are different than DC, than Australia, than, California. And if no one has ever
Hmm.
said it, West Coast policing, Southern policing, and East Coast policing, totally different. I've worked for a few departments, um, and I've had almost 10 years of law enforcement. And Blonde and Blue came about because when I first got into law enforcement, I went into the first training I ever got that was outside of my academy training was called crisis intervention. So I became a crisis intervention officer, and in those situations, you are a highly trained officer that goes to mental health consumers, people in crisis, often people on drugs, things that can quickly become escalated if you don't have the right training. And so the point of that is to de-escalate and really show the human side of law enforcement. Um, and so really just being there for people and creating that connection for them in their worst moment that doesn't result in an arrest. It can, but not every time. The point is to give them opportunity and to really show them that you are there for them. And have empathy and understanding, right? Even though you're law enforcement. So it's kind of like being a social worker and a law enforcement
Mhm.
officer at the same time. You're kind of doing therapy with these people. And so that really resonated with me. And then as I got, so I spent more time in law enforcement and I had switched departments for one reason or another. Um, I saw a repetitive pattern. The longer I was in law enforcement, the more I saw people and other officers really, first responders, the more I saw the other first responders were not getting the mental health that they needed. The departments treated us like a number. And that's not every department I've worked for, but there
Mhm.
wasn't a program for mental health for first responders. It was super stigmatized. You cannot go, you don't talk about it. Sometimes after a critical incident, you would have a what we would call a hot wash. Hey, is everyone okay? Yep, no one's gonna say they're not okay in a group of people because we're gonna dog you, we're gonna joke with you, we're gonna, use that dark humor and that's just kind of the culture. Um, and we're gonna move forward because we have the next call to take. No one wants to be taken out of their job, their role. No one wants to be put on, suicide watch. And that's the biggest fear is that again, our job is a calling. This career is a calling. But if you say that you are struggling, you don't get to actually say that because you're going to lose your gun and badge. You're going to get put on leave, and then the whole department knows your
Mhm.
issues. So no one talked, and
Mhm.
it became a problem because then you're alienating yourself, and you can't go home and talk to your family about it because you don't want to traumatize them. So you're really just
Mhm.
in this and you're alone. And if you go through something, God forbid you have a critical incident, you have a officer involved shooting, a justified officer involved shooting, uh, you still don't get to talk to anybody. Or if you're going through something, if you get pulled into what we call an internal affairs investigation, you can't talk to anyone about it. You have to sign away that right to talk about it, but that is like, that is what you need to do. There's no connection, though. You get alienated, no one can ask you what's wrong, you can't talk about it, and it becomes this revolving cycle, and so I created Blonde and Blue because I realized that through connection is the only way we start to heal. Through talking about it with people who have lived the same experiences, whether you're in New England and there's an officer in Texas or a medic, or a firefighter. And we also, I built this network also for veterans because that type of trauma is something that they also relate to. And a lot of first responders are also veterans. So we treat them too. But we built this network not because um, my husband and I are, great people at talking, but we built it because that's okay if we're not everyone's cup of tea. But the point is that during our peer meetings and during these conversations that one person might connect to another from across the country and be able to connect with them. And we wanted to have people know that they're not alone in this.
So is there an option for anonymity when peers join this group? You talked about the stigma involved with like reaching out.
We encourage that. When we have our peer meetings, we don't ask their names. They can put John Doe, they can put anonymous, whatever the case is. The only difference is, so our we run everything as a hub through Patreon, because it's a free platform. A lot of people don't know what that is, but it's a free platform, and we like it because so every day I write an article about something that is psychology based because of my education, and then also through my lived experiences, but also applying it to cop talk, to first responder talk. So I'm not using clinical terms, I'm not using these things, although that is my understanding.
Mhm.
My experience, that's not how we talk, so we run everything through there,
Yeah.
and that is 24/7. So someone can post on there, hey, I'm going through a hard time, or hey, I really need to talk to somebody. And someone will give them a call. We do host weekly live sessions, and people come on there through phone, anonymously, change their names, whatever. The only thing we ask is that on Patreon, the link is for members only, so it's free to join. There's no, There's no cost. We do have a part where you can pay just to contribute, but that's not required. That is just kind of like a donation, um, because we do everything ourselves. But we ask
Yeah.
people, hey, we'd like your real name and phone number. You don't have to sign up as that. We ask them that just for us, so we can check in with them, do weekly check-ins. Hey, are you okay? Hey, how's everything going? I don't need your address. So if you tell me, you are having suicidal ideation, I don't really have a way to report it. My point in that is to be able to
Hmm.
help you in the best way I can. And that is often just to talk to you. And that's what an officer would do if they came to your house anyway. So the point of that is to be able to have those conversations and be able to talk people off ledges. Um, and then when you come on the peer meeting, you don't have to have your camera on. Most people actually come in with their cameras off, and by the end of the meeting or halfway through, they turn their cameras on, they change their name because they feel comfortable. But a lot of the time, people come in and just observe. And we just ask to know their names, and we keep that information confidential, just so we can make sure that if something, because it is a confidential source, right? We have to have a checks and balances system. So if something comes back to their department or someone, we can hold that accountable because that is privileged information. So that would be an issue, but we hold people accountable and we have
Hmm.
kicked people out before for that. So
I think about repeated exposure to trauma, whether it's law enforcement or paramedics, like first responders. It can often kind of rewire your brain in kind of an unhealthy or bad way. From your experience and training and education in psychology, how does cumulative trauma show up?
in the first responder community, it shows up gradually. I think a lot of the time it is often who you surround yourself with, but that is not something that you can control. You can't control the shift that you're on. You can't control, what people say, but it does help to be surrounded by positive people. And, you know, I think it starts to show up first with burnout. You start getting the negative attitudes of, oh, I got to go to this
Mm,
call again, or, this is the third time I'm responding, or, things like that. And it also shows up as apathy. And um, I, I don't think it's an intentional action. It is a really slow process that sometimes can hit quickly, but it starts to show up in ways of apathy, of just wanting to clear the call rather than knowing that this person needs to just honestly, most people just want to be heard. Um, Not every call needs to end in an arrest.
mhm.
That's really not what being a police officer is about. Um, you really need to be there for people, and that is what we all got into the job for. And so when you start to see those signs of apathy and the lack of motivation and the lack of effort, um, man, you're just sick and tired of the job, or you don't want to come into work. You're the last one in and the first one out. You stop wanting to, hang out with people outside of the law enforcement community because, you start to have this negative view of the public, which isn't true. The people that, are often calling us, they're just a very small fraction of the population. And often we're seeing them on their worst days. I've run into people on their worst days
Yeah.
and been stopped in the grocery store, a year later, and they told me that I changed their life because I spent the time with them. That call took me 3 hours. But what do I care? I have nowhere to go and all day to get there. I am there for you. That is the job, right? So it's really taking the I'm a law enforcement officer attitude and really turning it into a humanistic attitude, and treating people as they deserve to be treated, even on their worst days, even when they're cussing you out and calling you names. Um, that's really it.
Yeah. Okay, so and I interview a lot of women of across various careers. I think that there's a unique superpower in having, 2X chromosomes. I think when you talk about like really connecting with someone who's having the worst day or really trying to like engage them and solve the problem versus just arrest them. Do you, and there are certainly challenges that come with being a female, but do you think that you actually have some advantages?
I don't think it was as much as a positive thing, as it was in, the lower 48, in DC where
DC.
the majority of my experience has been. But I think that there is a power in being able to calm things down and being that voice of, I wouldn't say a voice of reason, but really just being the softer side of things of, "Hey, look, I'm not here to arrest you. I just want you to know," and kind of just giving that softer presence. I think every shift has that officer that, you hear them, coming to back you up, or whatever, and you're like, "No, no, I'm good, I'm good," because you know that right when they get there, they're gonna amp things up. You just calm them down and they're gonna amp it up. Um, there's always one, and that's
Mm,
okay. Sometimes that one is the one that's gonna save your butt in that situation, in a situation, because things can turn from everyone being cool, calm, and collect and fine to things hitting the fan real quick, blink of an eye with no rhyme or reason. And again,
mhm.
that can be a mental health issue, that can be alcohol induced, drug induced, and sometimes drugs hit when you're in the middle of the call. You don't know. So things can go from 0 to 100 very quickly in an unexpected way. But I think that being a female in law enforcement does have its power. It does have um, a strength in that, and being able to, yeah, just connect with people on a deeper level and being willing to listen to those issues, even if you don't agree.
Can you share a moment where, you had an incident, perhaps one of these critical incidents that you're, referencing really crystallized the belief that vulnerability can become a
Yeah,
strength?
absolutely. So as a crisis intervention officer and a hostage negotiator, actually it was the first commendation award that I got in Alaska. And when I was in it, I didn't think anything of it. It was me doing my job. Um, I still don't believe that I deserved an award for it. That's not like I'm still shocked that I have it. I was moved, but I went with my sergeant to a actually it was an ex-officer, not for our department, but an officer who had had a mental break from reality. He was retired and actually a very well respected member of the community. And I went to the call. Um, he was holding his girlfriend at gunpoint, and she had crawled down the hallway to get away and made the call to 911. We were able to triangulate the location, and because my sergeant at the time was actually an Alaska native, he knew where that house was. So, like I said, the resources there are a lot different than the lower 48. We can get a lot better resource with location down here, but in Alaska, we don't really have that. It kind of triangulates it, and we get a little tiny part of the geographic. But we'd have to check, 10 houses before we find the right one, if it's in that needle in a haystack type thing. Um, but we got there. We were there was only two of us working, him, myself, and then we had one more person who was a lieutenant. And so we got to the call. We went in the house, and um, I took, cover. He had point, but which point meaning he had his gun out, and I was covering. So I didn't have a gun in my hand. I was able to calm the situation down because I was able to talk to him and really explain, "Hey, look, this isn't you. You're one of us. It's going to be okay. I don't know what you're going through right now, but like talk to me about it. I want to hear what's going on, and just being able to talk to him about what the issue is. The issue wasn't that his girlfriend wanted to leave him and that he was holding her at gunpoint. The issue was that he was unable to pay his bills and he wasn't able to get a flight out to go to see his family who just recently passed away, and you know having these experiences, and that was his mental break from reality. And being able to talk to him, not drawing points to the critical incident that we're in, but really talk to him from a human perspective of, hey, how can we work this out? How are you feeling right now? What is going on in your head? Why are you feeling this way? Tell me more. How does that feel in your body? and just have these questions of grounding. What do you like to do? Ah, man, if you, if we get out of here, we can go fishing. Like, that's what you want to do. Let's go moose hunting. Let's go fishing next week, and giving them that perspective of not just being in the moment, but giving them something to look forward to and getting to know them as a
Mhm.
person and being able to have that vulnerability and explain, hey, I've been there. I had PTSD. I've gone through it. You are a public servant. You are a person at the end of the day, and we want to make sure that you get out of this. We want to make sure that you're okay. I can see that you're hurting, and just letting them know that you have a common ground. There's an understanding, and then at the end of the day, we're all just human. We all make mistakes, and having that ability to be vulnerable with someone and not let them see you as just an officer or just a cop that came through their door. um, that is what got him to put the gun down. And as soon as he put the gun down, I handcuffed him and he asked me to hug him. Like, that is what we did, and obviously we got her medical attention and all the things, right? But um, that was just me doing my job. That's not even doing my job, just being a good human, coming from a DC area,
Mhm.
that's not a new situation that I had been in, but it's not something that we often go into in Alaska. Um, so
It's a powerful image. And yeah, thank you for what you do for your community and for every first responder that keeps us safe. I think, really the silent heroes of our community that we as like you talked about, it's the minority of people that end up calling you and that you respond to. The majority of us really have no idea what you sacrifice, what you go through, the PTSD, like you mentioned, that you incur. It makes me wonder, looking into the future, if we think about your retirement party decades from now, you kind of wonder, like, will it all be worth it? Everything that you go through, will it all be worth it for all the good that you did?
yeah, so right now, personally, I'm probably going to be retiring from the profession very soon due to my PTSD, and the critical incidents that I've been in. Um, and there's something that I was thinking about recently. I personally don't have an alcohol issue, but when you look at the first responder community, um, that is a heavy dependence. Us first responders, we turn to alcohol. There is no events in law enforcement that you really can go to that are not surrounded with alcohol, whether it's a retirement party or just grabbing a drink after work or, every celebration or negative event, the deaths, the wakes, there's alcohol involved, and it becomes a coping skill. Um, that's not something, like I said, I'm more of I drink socially, but that's not something that I rely on. But having that and knowing that that is something that a lot of people struggle with, and that was something that I was very ignorant to until very recently. Um, but we all
Mm,
find ways to cope, and sometimes that's dark humor. For me, my coping was um, I just wasn't able to turn it off. I wasn't able to turn off the cop mode, and I personally, I just got married, and that was sacrificing, that was really hurting my relationship. I wasn't able to be vulnerable with my husband in times that I should have been, right? So I had to learn to let my soft side in again and know that I am safe. And it was really my nervous system. Even now, I can be perfectly fine in a very calm setting, and my nervous system goes off, and there's no rhyme or reason. But I shake like a chihuahua. You wouldn't notice it, but I grit my teeth. Things like that. Because in law enforcement, when you get upset, you can't show your emotions. So a lot of us compartmentalize things, which is why you get that apathy, right?
mhm,
And then the problem with that is that you burst at the seams in wrong settings, right? Like laughing at a funeral. Why would you laugh at a funeral? It's a sad time, right? These abnormal behaviors, and you tend to see that. Or my trigger is I love journaling. I write poetry. That is my outlet. But man, if someone steals my favorite pen at work or I left it somewhere, if I lose my pen, I am off the handle, right? Simple little things like no reaction should happen for that. But at the end of the day, you asked about the worth, if it was going to be worth it. And I can honestly say that it has been. And getting out of law enforcement, especially, I'm only 30, especially now. Um, there's still so much that I'd envisioned for my career that I want to do, but I think my calling, being able to help first responders and people who are still out there holding the line, whatever line that is, whether it's EMS, firefighters, corrections, all the things, nurses, doctors, um, it is worth it, and I want to be there to help them so that they can continue to keep doing that because I think there is a time that we need to know when to tap out, and I think that is my time at this point. But at the end of the day, it was worth it, and I would do it again in tenfold.
I think the compartmentalization, like you talked about, it's such a poignant thing. It certainly is a protective thing in the moment. You have to compartmentalize your feelings to be safe and effectively execute the tasks at work. But then on the flip side, at home, it's a complete detriment because compartmentalization just keeps it in. And like you said, you want to burst at the seams. I went through a little bit of a personal rough patch last year. I tried meeting with some different therapists, and this is something I've not really shared publicly, but I just didn't feel like they didn't get me. Like I feel like I was wired in a different way, and I found a surgeon who it sounds like similar to you. Like she retired from being a full-time surgeon, and now she just does surgeon coaching. And just instantly, I felt like her having the experience really helped us just instantly be on the same playing field. And I imagine that your career in the future, like you will just instantly know what folks have been through because you've been there, you've done that. There's an immediate understanding of everything that they've
Yeah,
seen and
absolutely.
experienced.
I'll say 2 things about that. One, the reason we do Blonde and Blue, um, the nationwide peer support network, um, it's made by first responders for first responders because when you're in that field, you don't wanna traumatize anybody else. You don't wanna talk to people who haven't been through what you've been through because they don't understand. There's an entire culture that, is behind it, and there is a total lack of understanding. Regular therapists, even trauma therapists, mean well, but they don't really understand the culture behind what is happening and what it feels like in that moment and how that transfers over to the rest of your daily lives, why it transfers over into your relationships, into how you treat people, into, I don't see it as much anymore, but and that old saying of, why we can't sit with our backs to a door. I don't see that very often. But recently I
Yeah.
went to a conference and I realized that I was constantly looking around the room. I was paying attention, I was listening to what was going on, but I was not really looking at the presentation. I could not stop looking at everybody else around the room, and there were 3 or 4 people who would consistently look back at me, and make eye contact, and I was like, "Wow, this is hypervigilance in action," and if you had asked me before, I would have said, "No, I'm not hypervigilant, I'm fine, I'm totally relaxed in, public settings and whatever." And I was in a conference for other first responders. Like, there's no safer space.
Hmm.
Everybody in there has a firearm, like, but for me, I'm looking at that and I'm like, wow, that's something that I didn't know that I had, and I really realized that. And the other thing I will say about that is, um, I have gone to therapists as well, and not every therapist is going to understand you, and it's sometimes it's like trying on shoes. You have to it might take 2 or 3 sessions, of trying them on, walking around in it a little bit, and, you have to find the right fit and the one that you feel comfortable with, and, for me, I like to be challenged in my ideas. I want to understand why I'm wrong or why I'm not doing something right, or and I will challenge them back. Okay, well, if you're giving me this perspective, let me see the research, or tell me about the research that went into this, because I'm not sure that that actually applies to me,
Hmm.
rather than okay, you did a study on the general population, so that might be fine for everybody else, but first responders have higher suicide rates and veterans, right? Like higher suicide rates, higher stress rates, but we also have higher tolerance rates for what we do consider a trauma, right? So, and some things we don't even realize are traumatic, and it comes back, a few years later, and we're like, wow, I feel this now, So there's just different things. The community is entirely different from the general population, and I imagine it's the same with the medical field, and that is something we also include. We are going to branch out very soon and do we do also serve the families of first responders, so we do a lot of resources and working with them. My goal is to ultimately have a peer group once a week. Maybe 5 days a week for first responder families, and kind of break it up into an everyone group, for the family group. So the spouses of the first responder can come in and talk about their issues and things like that. And we do partner with, different first responder uh, wellness centers. That's a nice way of saying a rehab center for mental health, or any substance abuse or
Yeah.
treatment center. But they're incredible. So we do a lot of partnerships and conferences and talking and things like that. But at the end of the day, we're here to make connections and build something together so people don't feel alone in what they're going through.
So, for any first responder that's listening, whether they're in a law enforcement position or healthcare, like doctor or ER nurse, what's one thing that you want them to remember?
You have to know your limits. And as first responders, we are naturally selfless. Um, we love putting other people first. We don't feel like it's a burden. That's what we like. We love to do. We live for it. But at the end of the day, you can't pour from an empty cup. You have to take care of yourself first. And sometimes that is saying no. And also, the other thing I will say is that don't forget about yourself. You have to talk to someone. And I highly encourage not talking to someone in your own department about what you're going through, because working in a first responder capacity, we all know that it can be gossip central. It's like being back in high school. um, come come to a peer support program. If
Hmm.
it's not mine, that's okay. Like I said, we're not everybody's cup of tea, but finding that outlet, um, and really having that ability to share what you're going through, even if it feels so silly to you, if it's eating you inside, that's what matters. You just have to talk about it, even if it sounds silly. We have people who come into our peer support program sometimes, and they talk about the same thing for 5 weeks, and then one day they're like, "Hey, man, I feel better. Like I feel better about this," and then they move on to something else. Um, so some we don't you're not a burden. We want to be there for you. We want to hear you, and having that connection and being able to talk to someone who you trust, or who is completely anonymous and doesn't know who you are. Um, Find something, because that is going to save your life.
Well, Dylan Cade Bates,
Thank
firstly,
you.
congratulations on the recent marriage. I want to thank you for sharing your story, for creating such an incredible resource that is needed for first responders. A huge thank you. Thank you is not even enough for everything that you and all of your fellow law enforcement team does for every community in the United States. Where can listeners learn more about Blonde and Blue?
Patreon.com/blonde and blue. That is our hub. And you can join as a free member. You'll be able to see the conversations, the posts. You'll get a daily email. We do not spam you. You'll get a daily email about things that are going on, or just that little tidbit of, like I said, I write everything. If it's not your cup of tea, it doesn't apply to you, delete the email. Not a big deal. Right. But there's also, we put all of our links in there for um, YouTube, Facebook, Instagram. We have all those things, but Patreon is the hub. So if you go there, you will find anything and everything. You also find the peer meetings that we do weekly. Right now they're on Thursdays. We're like I said, expanding very rapidly. So just look to there, and we'll be there. You can message us directly. Phone number is on there as well. So please feel free to reach out with anything.
Today's episode is brought to you by the Hippocratic Collective. Check out our shows and content at hippocratic-collective.com.